This episode is brought to you by my 10-week Fertility Awareness Mastery Group program. If you're listening in real time, registration for my January 2018 groups is now open. To reserve your spot today, make sure to head over to fertilityfriday.com/group program. That's fertilityfriday.com/group program. This is the Fertility Friday podcast, episode number 168. Welcome to the 168th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Today, I have a special episode to share with you. I'm really excited to bring another installment of my Fertility Awareness Reality Series to you. And so in today's episode, I'm sharing a session that I had with Ashlee. Ashlee is one of the members of my most recent group program, and Ashlee was part of the conception group. And at the time of this recording, Ashlee and I are about 8 weeks or so into the program. So Ashlee is now a seasoned member of the group. She's really comfortable with charting, and so that's reflected in our conversation. And so I'm really excited to share today's episode with you, just to give you a little bit of insight and window into what it's like to work with me, what it's like in the group session as well, and also the process of charting. And it's interesting how it shifts from the very beginning stages of learning how to chart everything, the fertile signs and the kind of the basic understanding of it, to where Ashlee and I are now, where she's got a really solid understanding of the basics of charting. And now we're moving into tweaking the cycle and really trying to figure out what her cycle is saying about her overall health and fertility. And so just a reminder, whenever I air my Fertility Awareness Reality Series, and it also applies to all of the episodes of the podcast, this information is not intended to be medical advice, and all of my clients are working with practitioners. So all of my clients have their own medical doctors. Many of my clients work with naturopaths or other functional health practitioners, and all of my clients are working within the context of professional relationships with health practitioners, in addition to working with me in the programs that I offer. And so if you're looking to deepen your knowledge and understanding of fertility awareness, or you're looking to really gain clarity about what's happening in your own cycle and the link between your menstrual cycle and, your health, I would love to have you in my next group program offering. And so the next round of my 10-week Fertility Awareness Mastery Group program is starting in January. And so we're going to be starting 2018 strong. I'm opening up registration for my 10-week Fertility Awareness Mastery Group program in November and December of 2017. And so in December, I will be wrapping up enrollment and application, that whole process, so that we are ready and able to start basically first thing as soon as the new year begins. And so if you're wanting to be part of the group, I'd love to have you. Make sure to apply as soon as you can, so that there's, at the time of this recording, I still have space in both groups. So I have one group for conception. So for women who are actively trying to conceive, or women who are planning to conceive kind of shortly in the future. And then I have a separate group for women who are primarily planning to use the method as birth control currently. And so although both groups we talk about essentially the same things, given that we separate them a little bit, the focus is a little bit different, although the information is very much the same. And so make sure to head over to fertilityfriday.com/group program. And you can actually apply right from that page. And there's information about when the groups will be and the times for the different groups. And so again, that's fertilityfriday.com/group program if you wanted to be part of the group. So without further ado, let's jump into today's reality series session with Ashlee. And today I'm excited to welcome my guest, Ashlee, to the show. Ashlee is a current member of my Fertility Awareness Mastery 10-week group program, and she's in my conception group. And she has volunteered to come on the show and share a little bit about her experience and participate in the Fertility Awareness Reality Series. So I'm super excited to have her here today. Thank you, Ashlee. Welcome to the show.
Hi, Lisa.
Well, glad to have you here. We were chatting a little bit in the pre-chat just about what we'd focus on today. But I'd love to start with just a little bit of background about you and your history. Maybe an easy place to start is when you first got your period, and then a little bit about your birth control history, just so that the listeners have a sense of where we're at today.
All right. So I started my period, it was in 6th grade, so right at the end of 6th grade. So I was probably about 12. And I had what I thought, pretty regular periods almost every month. I never had really horrible cramps, or I never had painful periods or heavy bleeding or anything like that. And so when I was 18, I started the pill for conception purposes. And I've been on and off the pill, was on and off the pill for 8 years. I came off a couple times just to try the NuvaRing, or I just, for some reason, was like, I skipped this month and I was going to start the next month and whatnot. So I was on the pill until August of last year. So I just woke up one day and was like, I'm done. Like, I don't want to take it anymore. I knew we were going to start trying to conceive in the spring. So I was like, I'm just going to get off of it now, because I don't know. I just had this sneaky feeling that I needed to get off of it sooner than what my doctors were telling me. And my period came back probably within 38 days, I think. And I had a period every month. So,
well, and in your case, one of the kind of positive things is that you started menstruating around age 12. And, although 18 is still early, of course, from when you kind of look at the whole picture, especially from listening to the podcast and getting a sense of how long it takes your cycle to mature. But in your case, at least you did have about 6 years.
Yeah.
And so do you remember what your periods were like? So you mentioned they were fairly easy, straightforward. They weren't problematic.
Yeah.
But do you remember details, like were they fairly consistent? Did you ovulate regularly, or do you remember anything around that?
Before I started taking the pill?
Yeah.
Yeah. I didn't really even comprehend the fact that all of that was going on in my body. So
yeah.
I don't know. I don't know if I was ovulating or not.
Yeah.
But they were pretty regular. I would say, I can't ever remember going a long time without getting a period. It seemed like I was getting it every month.
Yeah.
So I would assume I was ovulating every month.
Yeah.
Yeah.
Well, because it's hardly scientific, but one of the observations that I've made is that, if you have started cycling and your cycles were able to kind of mature before you started the pill, it seems to be a little bit easier for them to pick up where they left off. But then if you really went on the pill immediately after you started, or within that first year, and you never really got to the point where your cycles actually were able to mature a little bit, then it seems like it's a little bit harder to get it started again when you come off of hormonal contraceptives.
Yeah, that makes sense.
Yeah. So in your case, your period came back pretty much right away, and your cycles have been fairly regular. So maybe you can share just what some of the concerns that you had were after coming off of the pill, and what you were kind of wanting to look at the most.
I think coming off the pill and then trying to start to conceive is when I started noticing, or I started becoming more involved, I guess, in researching everything involved with trying to conceive. And that led me to fertility awareness. And so now I've learned what normal is and what normal is not. And so we started trying in May. So we're 6 months in, and no baby yet. But I think that's just made me more aware of things that maybe I need to change in my own personal life. I have had lower end temps. I've had some months with no fertile cervical mucus or peak mucus. I've had spotting. So I think there's a lot that I know we've talked about and been working on for the last 2 months.
Yeah. Okay, so you and your husband have been trying since May, so that's about 6-ish months or so. And so what I'll do is I'll pull up the form as I was telling you about, just so that we can kind of go through that together. So how are you feeling with charting? Just to kind of go into where you're at. We've had a couple of sessions together, so just so that the listeners know, we're more than halfway through our 10-week class. So Ashlee and I have been together now for, I think, 2 months. Yeah. And we've also had multiple hot seat sessions within the group. And then we've also had a one-on-one session. So I feel like we've really hashed out a lot of what's been happening on your charts. But I still just want to check in with you. Is there any, in terms of the charting, the observational routine and all of that, I know you're feeling fairly confident, but has anything else come up around just the charting in general, or mucus observations or temperature, anything like that?
I think, one thing that I still am a little confused about sometimes in my post-op phase, in the follicular phase, I do get, what I would call creamy mucus before knowing all the mucus observations. And sometimes I can get a little bit off of the tissue, but it's not like I can't really go pull my fingers, finger test it. So, I mean, it's I think I said in the Facebook group, if I move my fingers around, it kind of smooths out like lotion would. But I'm sometimes there's a lot, sometimes there's not a lot. So I don't really know all the time what to record when it comes to that.
Mm-hmm. Well, and so for listeners who may not be sure exactly what you're referring to, Ashlee, so after ovulation, Ashlee's using the wiping technique, so checking for mucus, and then on the toilet paper itself, there is something, but it's not enough for her to actually pick up and test between her fingers. And so that is typically, if you're not able to pick it up and test it between your fingers, then that's typically how cell slough shows up. So that's, we've talked a little bit about that. So I see that on your chart, I'm just going to share the chart with you here. But on the chart, you've been marking it basically like we've kind of spoken about in the group. And so, and in your previous chart, so the September to October chart, we actually saw that you were having some mucus that you could pick up. And you mentioned in our pre-chat that in this cycle here, you haven't seen as much of it. So there's a couple of different reasons why you might see it. And I think we spoke a little bit about it in the group. So obviously in your post-ovulatory phase, so after ovulation, your ovaries produce higher progesterone, and that typically stops your cervix from producing any mucus. So if you are seeing some degree of mucus post-ovulatory, it could mean potentially that maybe your progesterone's a little bit on the low side. That's one of the possible things it could mean. It could also mean that your body's having a harder time processing estrogen. So it could be that your cervix is being stimulated. And we've talked a lot about xenoestrogens and other sources of chemicals and different things that mimic estrogen. So, but in your case, I'm not sure if that's what it is. Also, so because I know your history and background, you had a diagnosis of thyroid, and so you're taking, you're on levothyroxine right now. And we've spoken a little bit about just supporting thyroid health, and because if your thyroid is low, then your temps will be low, and, low metabolism, low thyroid function is also associated with low hormone production. So it could, the way from my perspective and from, the work that I do, I see that all these things are related. And I think I've talked about on the podcast sometimes where it's like you hear low progesterone and you think that is the issue, but then the question that we really should be asking is why. So, so to kind of sum that all up, in your case, what I see is that it's improving. So we're seeing kind of a progression towards less of that. And so, and we're also, for the listeners who can't see your charts, in the previous chart, your temperatures were a little bit lower, as we talked about in the pre-chat, and we're seeing an improvement. So whatever you're doing seems to be boosting your thyroid production, boosting your metabolism a little bit. And that could be the result could be that your progesterone production, your hormone production is a little bit stronger this cycle. That could be, of course, this is all conjecture. Like I can't jump into your bloodstream and check, tell you what your progesterone level is right now. But just based on what we're seeing on the chart, it would indicate that this is something that's improving.
Yeah. Could there be a reason why I would have more cell slough after ovulation compared to before? Is that the same thing like you were just saying?
Yeah, because when that shows up, like I said, it could be lower progesterone, it could be higher estrogen, it could just be something like that. And so one of the ways that you could boost your progesterone production is kind of find a way to incorporate some magnesium into life somehow in the post-op. And so gently you could do that just by taking Epsom salt baths or doing like a magnesium spray.
I've been trying to take more baths, like Epsom salt baths, every couple days because we've talked about that. And it's also good for me to just relax and decompress for 30 minutes. Yeah. And I did get some magnesium flakes to make a spray. So I just got to do it.
Well, because it seems like something so small, but I have had success with clients kind of just incorporating more in an intentional, way in the post-ovulatory phase.
Mm-hmm.
In situations like that where you're seeing mucus and it looks as though your progesterone, so that would be kind of like my gentle suggestion for now. Because one of the things that I'm sure has come up in the group is that when you're tracking your cycles, and especially when you're working with me and we're using a method that is so detailed and precise, you can really get to the point where you're trying to make your cycle quote unquote perfect. And so we've talked a little bit about that. Your cycle, this chart, it looks very healthy.
Yeah. And I'm excited. Like, yay!
And so for the listeners, like what that looks like, because of course you can't see Ashlee's charts, is that so she had period 3 days, so a little on the shorter side, but within the normal range. So the normal range for a period is 3 to 7 days, and one of those days were like heavy bleeding, so moderate and heavy. So that's within what I would consider the normal range. Mm-hmm. After your period, you had several dry days. You had like one kind of random day of non-peak mucus, but basically you had dry days leading up to your fertile window where you had 2 days of peak mucus, and then it dried right up after ovulation. I suppose the one thing is that the temperature spike seemed to lag a little bit.
Yeah, I had those 2 days of peak mucus, and then I think it was like 3 days later I ovulated, I think.
Yeah. And do you remember,
if I have to look,
were all those temperatures normal? Like were all of those days? It's hard to remember though, but.
Yeah, I mean, nothing out of the ordinary.
Yeah.
That I can think of.
Yeah. So that's the only thing I would say that kind of, there's that little bit of lag between. So we would expect your temperature rise to be more in line with your peak day. So for the listeners, the peak day is the last day of mucus, of peak mucus. So clear, stretchy, slippery. And so in Ashlee's case, she had her peak day on day 14, and then the temperatures rose. So we could consider the 18th day to be the rise, but that's like the 4th day after. So that's something that we can look at.
Okay.
Just like I'd be curious to see what happens next cycle. But overall, so, we see mucus, and then we see that your mucus dried up, and in your post-ovulatory phase, we're not seeing non-peak mucus like we did in the previous cycle. So, and as you mentioned too, we're not seeing any spotting yet. So we're not seeing any spotting before your period starts. So it's really tempting to look at all these things and be like, oh, this is wrong, and this is wrong, and this is wrong. But when you take a step back and look at the whole picture, your cycles looks pretty good.
Yeah.
And I don't have a ton of, we don't have 6 months back because we haven't been working together that long, but we can see that shift between the previous cycle and this one.
Yeah. It's crazy. You just make a couple changes and you keep doing things and it just shows up in your chart. It's kind of cool.
Yeah. Well, and so for the listeners' benefit, maybe you could share some of the changes that you've been making over the past couple of months.
Mm-hmm. So one thing I've been doing is trying to make my own cleaning products. So trying to just get rid of those xenoestrogens. I make right now my laundry detergent and my dishwasher pods. And then just an all-purpose cleaner that I use, and toilet stuff and all of that. So that's been a big shift. And then recently, probably within the last 3 or 4 weeks, I've been incorporating more healthy fats into my diet. So I've been eating butter and whole milk and bacon, and so that's been fun.
It's like it must taste horrible.
Yeah.
You must feel like the most deprived. You must feel such a sense of deprivation.
Yeah. And then I've really been trying to focus on my sleep, trying to make sure that I have turned the TV off, put the phone away, between 7 and 8. And like I said, I've been taking the baths to relax and reading a book, and just making sure that there's not a whole lot of light in the room when I'm sleeping. And so that's been good too, because I feel like I get so much better sleep than what I used to before. So, and some of it's I've been doing for a little bit of time, and some of it's just fairly new. So, but even all of it together, I'm like one step at a time. If I can just do one thing each week or whatnot, then I'm making improvements.
Mm-hmm. Well, and the side benefit of magnesium, so of course we talked about how it can support progesterone production, but the side benefit is that because it's literally like your muscle relaxant type of situation. So magnesium can help you sleep better too.
Yeah.
So lovely thing to do before bed, side benefits.
Yeah.
So one thing that I just want to check in with you about the charting aspect, especially when you're actively trying. So you and your husband are still then actively trying at this exact moment.
Yes.
So one of the things in terms of timing is that, especially just in general, I think, so based on what I see, like you're timing accurately, so there's nothing wrong, but just giving information. So of course, the best day is any day that you have mucus with peak qualities.
Right.
So that's optimal. And then when you identify that it's your peak day, so you wouldn't have known on the 14th day that was going to be the last day of your peak mucus. And so then you want to have sex on peak day and then like the 2 days after. So essentially like when you notice that you don't have the peak mucus anymore, you still have sex for the 2 days after to kind of just maximize. And the reason for that advice, because it can seem counterintuitive, but, in your case, your chart illustrates that the way the statistics go is that the majority of the time, like the highest percentage of women will ovulate on their peak day, but some women will ovulate on the day before peak, and some will ovulate. Most women will ovulate either the day before peak or up to 2 days after peak, and there's a small percentage of women that ovulate up to 3 days after peak. And so it might seem counterintuitive to keep having sex after your mucus is gone, but that's a way just to kind of, you're just like covering all bases.
Yeah. Making
sure. And then in your case, especially because we're seeing, hopefully this is just like a one cycle random delayed ovulation, but it's a way just to cover the bases, especially because we can see here that in this case, there was a bit of a delay. The last cycle, there wasn't. So in the last cycle, we did have and that's interesting too, because in your last cycle, you didn't have any days of peak mucus.
No.
So in the last cycle though, but you still had mucus. So you had, so non-peak, for those listening, you can think of as creamy. So it's like, typically white in color and it doesn't stretch a whole lot. And then you can think of peak as being like clear and stretchy, and when you're wiping with a lubricative sensation. And so in the last chart, you did have mucus that was not clear, but it did stretch a little bit. And so that was more in line with the temperature shift. So this could just be like a one-off, or maybe one of those temps were just off. Like we don't know.
Well, and I think right before ovulation I started taking some supplements too. So
yeah, so it could have made an impact.
Yeah.
Yeah, because one of the things that has come out in the group a lot, and I think it surprises everybody who I've worked with, but how supplements or whatever random injection you have to get from a doctor, that was in my interview with Amy. We talked about that in her experience. But just, I see it a lot where if you have a medical procedure of some kind, it's going to affect your cycle, and then other things too. But yeah, just that kind of note about timing. And refresh my memory. So we had spoken about whether or not your husband was going to do like a semen analysis, and I think you said that, did he have one and it was good? I don't remember.
Yeah, he had one pretty soon after we started the group session, so maybe at the end of August, and it was normal.
Yeah,
there was nothing on there that was surprising.
Yeah, that's right. Yeah, I just pulled it up here, so everything looked pretty good on his end. High concentration of sperm, pretty good morphology.
Well, and I just thought of something else that I changed too, is I started incorporating more organ meats into our diet. So I've got some beef liver and some beef heart, and been trying to put that in things also. So
yeah, we spoke about that a lot in the group, just as a easy, if you can tolerate it, if you can stomach the taste of it, if you can find ways to cook it and incorporate it that are yummy.
Yeah.
then it's a great way to incorporate more nutrients just to kind of build up those stores, especially in the preconception phase when you're really wanting to build up those nutrients.
I just grind it up and put it in whatever ground meat I'm eating and can't even tell that it's there. It's amazing.
Well, yeah, no, I'm happy with what I'm seeing in terms of the improvements that we've seen on your chart. I'm happy with, so we know that you have an issue with your thyroid, but your temperatures are looking a lot better, like in terms of where they should be. And we're seeing that positive forward motion in your chart. So I suppose the only thing for when our group is over and when you no longer have us every week, just know that, healing doesn't always happen in a straight line. So if you ever have a chart that's a little bit wonky, I think the first thing to do is take a look at it and try to remind yourself what was happening around that time. Because I don't want to give the impression that just because you make some changes that every single chart then is just going to be like better and better and better in this perfectly linear progression. Because sometimes you have, sometimes you have a chart where it kind of doesn't look that way and you get discouraged, but your overall trajectory is still positive. Mm-hmm. So just kind of one of those for when we're not together anymore. But just based on everything that I'm seeing, I mean, it looks like we're moving in the right direction. So, I mean, in our last session, we talked a lot about sleep. And so you've just made a ton of changes. Like you went through the things that you've been changing, and it's really significant. Going through and changing your products is one of the most stressful things, and it's very challenging. And so just by doing that makes a huge difference. Changing, the fat ratio, changing the types of food that you're eating, all that kind of stuff, that's pretty huge. Are there any other areas or any other topics in particular that you want us to focus on and talk about in today's session? Is there anything else that kind of we didn't get a chance to talk much about in previous sessions?
I think we talked a little bit about this in the pre-show, but just like what can I do to possibly increase my peak mucus before ovulation? Because I mean, like, there were the 2 days, but it was one time each day, so it wasn't like I saw it throughout the whole day. It was like one time and one time, and I would say little. It wasn't like a lot, so it was very little. And I know that doesn't always make a difference, but just something to do, something to increase the peak mucus.
Yeah. So that's always, I think that's something that is applicable to a lot of the listeners and just in general. So I just want to start so this might be a little bit like I'm going around to answer the question, but I think the first thing is to really think about just the whole context. So in our session together, we talked in depth about mucus and the cervix and the different cervical crypts and all that kind of stuff. And the reason I'm bringing that up is because it's common what I see for women who have a history of hormonal contraceptive use over the long term, so like 5 years, 10 years plus, to have fewer days of mucus. So that's par for the course, you could say. And that's because for every year that you're on hormonal contraceptives, there's research to show that it actually ages your crypts twice as fast as you normally would. So I think the first thing I want to do is kind of just point out that although you're not having like a ton of days of mucus, one of the reasons that might be is because of it could be related to the hormonal birth control history. The second thing is that there were some studies that were done that show how much mucus women actually produce. And so the other challenge about a really detailed charting method is that it allows you to quantify your mucus. And so all of a sudden you're looking at it thinking, I should be producing way more. And so I work with a lot of women who think that they're not producing enough. But there's this a couple of research studies where they actually put like a really thin aspiration needle into the cervix and withdrew it to determine how much mucus women produce. And one of those studies showed that women produce like 20 to 40 milligrams of mucus every day. And then in their peak window, their fertile window, they produce up to 20 times that much. But if you look up what that is, it's like a quarter to a quarter teaspoon, I suppose, would be the ratio, like on the top end per day.
Mm-hmm.
So I guess the reason I'm saying that is just, first of all, to say that, like, we'll talk a little bit about how to improve mucus, but basically my top suggestions for how to improve mucus, I don't have a magical suggestion for you, because since mucus production is related to your hormone production, what we really want to do is improve that. And all of the things that you're doing are already addressing that. So when you know you have a thyroid issue, supporting thyroid function, so we've spoken a lot about that, just different ways to kind of improve that in metabolism, that indirectly affects your mucus because that helps to improve your hormone production. So it's kind of annoying because I'm like, well, we talked about all the things to improve hormone production. That's essentially one of the first things we do to improve mucus production.
Yeah.
We spoke a little bit about the role of vitamin A, so kind of cod liver oil as a natural source of that, because that you need that for hormone production. So essentially I'm going around about and saying that when you improve your hormone production, that indirectly affects your mucus production. But the reason that I'm talking kind of in circles is because, first of all, I don't want you to think that just because you don't see a lot of it, it necessarily means that that's going to prevent you from getting pregnant, even though it might sound a little bit strange.
Yeah.
Because one of the things that we talked about in the group is that when you're looking for mucus, although we do want to look at how much, so you do produce less than, what we would consider to be ideal. So in a normal cycle, we'd have 3 to 6 days of mucus with at least 1 day of peak all day. So that's what we would expect to see. And so in your case, in this cycle, you had 2 days of peak, but you didn't have it all day, either day. Mm-hmm. So it's a little bit less. But with that being said, when you're trying to conceive, if you're producing mucus, that means that on that day, your cervix is open. We know you're in your fertile window, and we know sperm can survive in there. So I guess my suggestion is to try to just keep in mind that when you have mucus, regardless of how much, it still means that you're fertile that day.
Okay.
I'll stop chatting, and I just want to get a sense of what you think of all that, because kind of, does it make sense? Or
yeah, I think only time is going to be able to tell whether, like you said, I've made these changes, but that doesn't mean that we're always going to see it every cycle, or maybe the next cycle I'll see a little bit more. Maybe I'll have 3 days instead of 2. So yeah. I think it's just more seeing what happens in the next cycle and hoping that each cycle gets a little bit better.
Well, and I would be encouraged, so I'm encouraged because even between the last cycle and this cycle, so in the last cycle, we had no peak mucus. So there was no clear mucus at all. And in this cycle now, we have clear mucus leading up to, so peak mucus leading up to ovulation. So what that shows me is that we're moving in the right direction. Mm-hmm. And it's always, we don't know what you're going to see in your next cycle, but I think that this is a strong indication that we're on the right direction, because going from not having any peak mucus to having 2 days of peak, kind of leading right up to ovulation, I think that is a good thing.
Yeah.
And in terms of using the fertility awareness method, as it's intended as a way to time pregnancy, you really don't want to get hung up in how much. For the strict purpose of timing, you just want to, if you see any of it that day, it just means your cervix is open. That's when you have the sex.
Right.
And then if you ever have a cycle where you have very, very little, then one of the things you can do is incorporate the cervical position charting. Have you done any of that at all?
Yeah. In past cycles, I've been a little bit better. I know I haven't recorded it on this chart, just because it's a little bit different than what I'm used to. I guess you could call me lazy. I didn't really look into how to chart it on here. But yeah, this cycle I didn't as much check for cervical position, but the previous cycles I have. So
well, and I definitely wouldn't call you lazy, because you have been working your tail off to make all these different improvements and changes. Yeah. So that I talk about the cervical position as an optional sign. So it's definitely not something that you have to do. my clients who benefit the most from it and who find it the most helpful are typically my clients that have limited mucus production, because then it gives them a tertiary third sign just to kind of triangulate everything with. Yeah. So if you're ever concerned that maybe your mucus is like you're not seeing as much, then I would suggest, if you feel to, like if you want to have that additional verification of whether or not you're in your fertile window, then doing that, checking for it every day for a whole cycle, being prepared to be a little bit bored because nothing's really going to happen. Yeah. Most of the time it's going to feel kind of, the same. And then there's going to be that one point in your cycle where you actually feel a shift. So that's one way to do it. And it helps you to identify when your cervix changes and it feels softer, higher, more open. So then that helps to corroborate. And then also when it shifts post ovulation, then you can also be fairly certain, okay, this feels really different. I think I ovulated, and you should be able to see that correlation. Yeah. So, I mean, there are sources, that, there are, women that will swear by evening primrose oil as something to increase cervical mucus production. The only challenge with that is that I haven't found any like solid scientific information to to reference that. Yeah. So it's something that, you can certainly try and see if you have success with it, but I can't say like, oh, there's solid scientific research on that. So there's so many reasons why I'm always hesitant to say like, use this thing to boost cervical mucus, because I know that I feel like it's complex. The clients who I work with that have limited mucus always have, and I shouldn't say always, I'll say often have a history of long-term birth control use. Many have had a history of HPV or an abnormal PAP. And often that comes with some sort of procedure to remove abnormal cells, especially if the infection was kind of chronic and didn't go away. Mm-hmm. And of course, there's always, okay, let me take a look at your history here. Abnormal PAP, yes. Did you have cervical surgery?
I didn't have surgery, but they did do a coloscopy, and they went and took out the cells that looked abnormal.
Yeah, and unfortunately, I'm sure we talked about this in the group as well, but there is a link in the research between long-term pill use and an increased likelihood of contracting a persistent HPV infection. So when you're not on the pill, you're more likely just to be able to fight it off, because it's like the flu. There's 100 different types of HPV, and yeah, it's literally like the flu. So when you're not on the pill, you typically just fight it off. But when you're on the pill is also associated with depleting folate levels. And when you don't have folate, you're more likely to get abnormal cells. So there's all of these things that are related to it. So in terms of supporting cervical health, we've talked about that a lot in the group. Supporting cervical health is also another way to improve mucus production. So folate is something that you could make sure that you're taking B complex, you're eating liver and organ meat. So there's going to be folate in that. So you're getting folate. But if you wanted to be a little bit more aggressive, you could take a little bit more. And vitamin A has also been shown to support cervical health. So knowing that you have the history, so in the form of cod liver oil, like in that type of food form. But just those, for me, those are evidence-based. Like you can find the research that supports those things, and then we know that they're integral for cervical health. So in terms of like what to do to increase mucus, and then just some hope and some words of inspiration. You don't have to have a perfect chart to get pregnant. So in this field that I'm in, I've seen a lot of charts. So I've seen charts where you look at it, all the mucus, all the sex on all the right days and no baby. And then I've seen other women's charts who are in a similar situation as you, where they've had long-term birth control use, a history of HPV, and some sort of cervical intervention, you could say, to remove some cells, having limited mucus, because that comes with the territory when you've had physical, I don't want to say damage, but that's physical procedure on the cervix. And like getting pregnant with not necessarily loads and loads of peak mucus. So there's more to getting pregnant than just having loads of mucus. And once you sort out your thyroid health and your metabolism and your cycle start to look a little bit better, you know, in your case, you've confirmed your partner's status in terms of his sperm quality. So you're doing basically everything in your power to improve your cycles and improve your cervical health and all of that kind of stuff. And so I suppose from now, we just have to kind of wait and see. I could take this opportunity to rant about the pill, but...
Tell me about it.
That's one of the things I can say that I didn't expect when I started doing this work. Like, I didn't expect to see the number of clients that I see that have had a history of just cervical interventions, abnormal PAPs, and it's often, just so often related to long-term pill use. And it's not a coincidence. So I can put it that way.
Yeah. I was telling my husband, because I think it was our last group session that we had talked about cervical health, and another one of the girls had the same procedure that I had. And I was like, that's just one more thing that they did. And then, you know, my doctor even told me, like, most of the time, like you said, certain strands of HPV go away. And, you know, so it's like, if it was going to go away, why did we need to do this procedure? Why didn't we wait and see? And so it's just like, blows my mind sometimes.
Well, and I guess with that said, I don't want to give the impression that no one should ever have surgical interventions, because cervical cancer kills people. So it's not like something that we should just sit here and be like, no one should ever, because that's not a real thing.
Right.
The challenge on my end is that there is research that has been done. So you can find clinical studies that have been done where women with abnormal cells have been given folate. So specifically kind of a certain amount of folate daily for like a 3-month period, a 6-month period. And so, you know, after that period, then they're examined to see if the abnormal cells are still there. And in many of the cases, just by supplementing with folate over an extended period of time has reversed and basically completely gotten rid of the cells in a number of women and reduced it in a number of women. So you could extrapolate that data and suggest that abnormal cells are potentially a result of a folate deficiency. And there are also clinical studies that have been done with vitamin A, like applied topically to the cervix, where, again, after a certain period of time, many of the cases are reversed. Mm-hmm. So, of course, it's not like every single person experiences like a total reversal of all of their situation, but there's a significant number of women who either experience a greater decrease in their cells than the placebo, or fully have it completely gone. So then, like the side effects of folate supplementation, you know what I'm like, there's versus the potential detriment to your fertility from having a procedure. So my question is, okay, I get it. We need to do something because we can't just let women just be at risk for cervical cancer. But if there's solid research and clinical studies that have been done that show that these interventions can reverse abnormal cells, why don't we just try that first?
Yeah. And I think, you know, more so, I wish I would have been more educated back then to know what was going on and to be an advocate for myself more so than anything.
Well, and ultimately you can't really, I mean, you can if you want to, but I don't, it's hard after you learn it to look back, after you learn the stuff and kind of like get exposed to these different things. It's hard to look back and think, you know, what if this, what if that? But ultimately you were doing exactly the best that you could with what you knew. That's what we all do. Yeah. And so as hard as it is, you know, you can't beat yourself up about it because you were, and I mean, the doctors too, the doctors that were looking out for you were doing the best that they could with the information that they had as well. Mm-hmm. So yeah, but that's why we're doing this very public conversation, so that, you know, I really want to give voice to real women who've experienced these things so that other women can just hear. So there's a lot of women listening who've had cervical surgeries, and it's helpful to have that normalized. Mm-hmm. And it's also helpful to talk about it because I'm not sure if the practitioners are either aware or advising women that it could impact their fertility. I'm not sure if they're aware. And so therefore, I'm not sure if they're advising. Because when you're trying to conceive naturally, it does make a big impact if your cervical crypts are damaged. And so although it may seem like a minor surgery to many practitioners, because you're just, just scraping off the cells, right? You're just going in there and but from my perspective, I think it's a pretty big deal. And if you can avoid having that, then that is a way of preserving your fertility for the future. Because if you damage the crypts, you're not just going to regenerate new crypts. Although with that being said, I don't want to give the impression there's nothing you do. So, Ashlee, we were talking about all the different ways we can support your cervical health and all the different ways we can support your hormonal health. And also that even if your crypts are damaged, it doesn't mean you can't conceive. It just means we probably have to be more specific with timing, especially if we're only having a couple of days of mucus in the cycle.
Right.
So that kind of brings us towards the end of our session. Is there any other last questions, comments, or anything that you wanted to chat about before we wrap up today?
No, I don't think so.
Well,
pretty much it.
What would you want to say to the listener who's in a similar situation or at some point in her journey with fertility awareness, just trying to kind of make sense of her cycle?
I would say, just keep doing what you think is right and make the changes that you think are apply to you, and to not be so hard on yourself. I think sometimes that, like you said, it's easier said than done, but you can't go back into the past and change what has happened in the past. So just make those changes moving forward and know that you're bettering yourself and bettering your cycle.
Yeah, and I'd love to hear just if you would like to share what your experience has been in the group. It's been a nice group. We have it's not too big, it's not too small. We have a good number of ladies in there. But I'm sure the listeners would love to hear what your experience has been like.
I think it's great getting to learn more than just what my cycle does every month, and to get to hear what, I think there's 6 of us, so 5 other women, what they're going through, and then you can kind of go, oh wait, that's happened to me before, and then you're getting even more information about what you can do in your own cycle. So learning in the group has really helped broaden my knowledge of fertility awareness, just because maybe I don't see it yet, but I could at some point. So it's awesome getting to learn from you and then from all the other women too.
Yeah. Well, thanks for sharing that. Yeah. I like that aspect of it, because for me, I've seen so many charts and it's sometimes hard to convey that, but in the group, I don't have to do anything in that sense, because we share charts in the group. And so you could just literally see with your own eyes, even women that have similar challenges, how it can show up differently on their charts. And so I appreciate you sharing that. Well, yes, Ashlee. So thank you so much for being here. It was a lot of fun having you on the show.
Yeah. Thank you for having me.
Well, and a special thank you for being willing to share, private details of your life in such a public way. I really appreciate it, because it really does it opens this conversation. It gives other women the opportunity to see what it's really like. We're pulling back the curtain on fertility awareness.
Yeah.
All right. Thank you so much, Ashlee. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/168. That's fertilityfriday.com/168. I hope that you enjoyed my session with Ashlee today. I just want to send a special shout out and thank you to Ashlee for being willing to come on the show and share her experience so openly. It was a lot of fun to have her on the show and just to kind of share a little bit about her experience, and even just her experience of learning the fertility awareness method and gaining confidence. So by the time you're listening to this episode, and at the time of recording, Ashlee and I have been together for several weeks. So we've been together almost 2 months now. We've been meeting every week with the group, and we've had a number of sessions. So we've had sessions within the group where it's one-on-one, and we've also had our individual session together that's part of the group program. And basically at the time that you're hearing this, Ashlee is very confident with her charting. Unfortunately, you can't see her charts, but when we look at her charts together, she's really confident with the method. She's really confident with her observations, and she's marking everything in there. We're really clear on what she's seeing in terms of her mucus patterns and things like that. So as you could tell by our conversation, she's feeling pretty good about the charting aspect of it. So by now she's pretty confident. And so she's not asking 1,000 questions about how to do the basic things around charting and mucus observations and basal body temperature, we're into what I often think of as kind of the second phase. So the first phase is really getting the charting down and really starting to understand what's happening with your body, with your mucus, and kind of the nitty-gritty of it all. But once you start to feel a little bit more confident with that, you kind of move into a second phase where you're more looking to tweak, you're more looking to understand. So now that we've got the observational part down, now we are looking at what we're seeing and really being critical of what's happening, any abnormalities that we're seeing, and what could be, behind any of those things. And so that's what happens. I often joke that, women come to me for fertility awareness charting, but what they really want underneath that is a deeper understanding of what's happening in their cycles and how it relates to their health. As soon as you start charting and paying attention, especially when you're using a charting methodology that is so detailed and precise, the one that I teach, it really leads you to be quite critical and just to really want to know what's happening and why, this thing is happening at this point in the cycle because it's typically supposed to happen at this point, or why are my mucus observations like this when my understanding is that they should be like this. So, that's really when we get into it together to be able to use your cycle and your chart as essentially a diagnostic tool. It gives us information about where to look, about what could possibly be going on, and combine that with health history, just having that knowledge, and especially in the group setting, being able to be together for, 2.5 months. It really gives us a lot of insight into what's happening. So I love the group. If you are new to the podcast, whether you're new to the podcast and this is one of the first episodes that you're listening to, or whether you've been listening to the podcast for a while, if you're wanting to really dive in and learn more about fertility awareness charting, if you're ready to transition from hormonal birth control to fertility awareness and gain confidence using this method as birth control, if you've been trying to conceive and you're wanting some insight into what's happening in your cycle, or you see that you have cycle abnormalities, but you're not really sure what's happening and you want just that additional information about it, then I would just definitely invite you to be part of my next 10-week Fertility Awareness Mastery Group program. So the next program is starting in January, and I'm doing my registration in November and wrapping up the registration in December so that we can get started right at the second week of January is my plan to actually get started and start having our meetings. And so, new year, new beginnings. If this is something that you're wanting to jump into, this is the time. So I would definitely encourage you to apply sooner than later. There's only a certain number of women that I can put in a group. So, just to make sure that there's enough space for you, make sure to jump in and apply right away if you're thinking about being part of the group. And so for more information, head over to fertilityfriday.com/group program. So you'll be directed right to the page and you'll see all the information about the group, when it's happening, what the dates and times are, and also how to apply. So definitely, if you're thinking about it, if you've been on the fence for a while, don't wait until the last minute. Just make sure that there's enough spots open for you. So fertilityfriday.com/group program. So I just want to thank you for spending some time with me today and supporting the show. I really appreciate you for taking the time to listen to the show, and for all of you who share the show with your friends, whether you're sharing individual episodes or the podcast in general. This podcast has been growing by word of mouth, and it's because of listeners like you who are enthusiastic about fertility awareness and really excited to share it with your friends and just kind of spreading the word about the podcast. So that's really how the podcast continues to grow. And of course, my goal, my passion is to share this knowledge with women because women just need to know how their body works. It's just that simple. And since, no one's telling us about it, we just have to jump in and tell each other. So that's basically what we're doing. So thank you so much for being part of this, for supporting the show, and of course for sharing the show with your friends. And so until next time, as always, be well and happy charting.